Thank you, Dr. Frederick. At the outset, I would like to thank AIOS and Dr. Frederick for having me in this session. My talk is on achieving clinical excellence through accreditation. As we know, errors are inevitable. That can happen anywhere and to anyone, and medical profession is no exception. The hospitals need to create a culture of quality in which the inevitability of human error is acknowledged. And according to me, accreditation is the best answer. Accreditation has become an integral part of healthcare system of late, and its rapid growth over the last few years is due to serious inadequacies in the quality and safety of healthcare services and escalating focus on patient safety. Accreditation helps us to institutionalize all dimensions of quality to achieve clinical excellence like patient-centeredness, timeliness, efficiency, equity, effectiveness, and safety, which will eventually lead to improved clinical outcomes. Now, what is clinical excellence? Clinical excellence is achieved when systems are implemented that are designed to bring about predictable, optimal outcomes that consistently meet or exceed patients' expectations. So accreditation does it all by ensuring proper documentation of systems, processes and outcomes, patient and staff safety and risk management, by establishing indicators and monitoring mechanisms, and by focusing on training and leadership capacity building, which will eventually lead to continuous quality improvement, leading to excellent clinical care. Now, why we heard about the documentation, the importance of documentation. Why documentation is so important in a clinical practice? Because a standardized system of documentation, data collection and record keeping and analysis of data will reflect continuity of care. We know that errors are mostly because of the system failure rather than personal fault. Could be because of inadequate training and supervision, lack of communication, lack of monitoring, or even lack of protocols for that particular procedure. So a complete patient records help tracking down serious systemic errors and even sentinel events. In our case, endophthalmitis, which is a sentinel event. So you can even track down endophthalmitis if you have proper documentation and details about your surgical notes, complications, details about your machines, consumables, surgical time, whether there was any undue delay in the surgery, whether the chemical indicators have changed the colors, or your biological indicator has passed the test of sterilization. You have complete record of your OT culture and fluid culture, then you can pinpoint and analyze the cause of infection. So with proper documentation, the things become really easy. Then accreditation emphasizes on the identification, measurement and analysis of key quality indicators, which are very, very important for improvement of different processes. So you can select indicators based on the structure, process or outcome of your systems. Like in our case, in an ophthalmic setup, patient satisfaction index, OT efficiency, waiting time, post-operative infection rate, cataract outcome, equipment breakdown time, surgical complication rate, and medication error incidents and sentinel events reported. So you can measure them against a benchmark which you can decide according to your own setup and against the benchmark of the Center of Excellences, the international benchmark. Accreditation offers principles that can be used by the healthcare to set goals for quality and safety. As I said, there are 6 goals for the quality. Timeliness is a very important goal, and accreditation emphasizes on timeliness and completeness of clinical information, and it is very important for effective management of patient care. So you can do time motion study to monitor the patient waiting time and improve upon it by cutting down on the non-value adding time, which will lead to more patient satisfaction. Accreditation leads to increased efficiency of your system by minimizing inappropriate variation, duplication and unnecessary repetition of your processes. And you can achieve maximal utilization of space, manpower and equipment. You can monitor and increase the utilization in your OPD by having proper protocols and processes. You can increase efficiency of OT by keeping a track or monitoring your OT starting time and reducing the non-value adding time between the cases. It will improve the efficiency. The third goal is patient-centeredness. So the accreditation focuses on the patient-centered care, and it's important to monitor the patient satisfaction, which is very, very important in terms of overall growth of the organization. So you can monitor patient satisfaction in terms of not only technical quality but also the behavioral aspect, waiting time, financial aspect and communication. Accreditation also brings in effectiveness in your practice by focusing on implementation and practicing evidence-based clinical practice. Like you can make protocols for different specialities, like as in glaucoma, you can monitor whether the glaucoma department or the doctors are following the protocols, like whether the examination is evidence-based, whether they are completing their examination and what is the gaps. Is there any opportunity for improvement? Then you can focus on that opportunity to improvement and then bring about changes. Accreditation brings about and help to develop an integrated patient safety program, which includes patient identification, communication during patient handover, performance of correct procedure, correct body site, assuring medication accuracy at the transition of care, and discriminating between look-like and sound-alike medication. And this will lead to remarkable decrease in the medication error or the error which can occur if you don't follow these practices. It emphasizes on improved hand washing compliance by reinforcement of principles of infection control and control. Also, it emphasizes on implementation of emergency codes, which will lead to a prompt response to emergency. Once you have implemented processes and systems and got an accreditation, it is very, very important to sustain it. And for that, you require an environment of continuous quality improvement in your hospital. And this can be achieved by proper incident management process, doing corrective action, preventive action, management review meetings and audits. Accreditation ensures that incidents, complaints and feedbacks are collected and analyzed. So every hospital who is accredited should have a proper incident reporting system where the incidents are properly analyzed and the corrective action, preventive action plan is made and then implemented. So you have the incident management form, then you have this corrective CAPA form wherein you detail out the incident and plan for the corrective action, preventive action. CAPA is a fundamental management tool to correct existing problem or implementing controls to prevent potential problems. And it is essential for continued improvement of the process. You can have an incident e-register with the details, whether all the incidents have been reported, what were the actions taken, whether you have implemented a change to prevent its occurrence. With accreditation, you start following procedures like timeout, which is very, very important to cut down errors in the surgical errors. Like everything stops for a minute before you start surgery, and the surgeon and anesthetist make sure that everything is in place. And if any special thing is required, that is made available. Monitoring mechanisms like audit and other monitoring mechanisms to oversee implementation and compliance of the processes and protocols in each department. And as we just heard, different committees are there, so it's important that the management is reviewing the minutes of the committee meetings and taking proper action. So accreditation have clear-cut benefits in terms like it provides a framework to help create and implement different systems and processes for all your clinical and non-clinical areas. It mitigates the risk of adverse events by carefully analyze all incidents and adverse events and taking corrective and preventive actions. It improves overall health outcomes or the vision outcomes in our scenario by providing properly, by focusing on implementation of proper processes and systems, and it promotes a quality and safety culture. It improves the organizational reputation among end users and enhances their awareness and perception of quality care. So to sum it up, accreditation helps us to have a proper integrated quality program which includes facility management, external regulations, risk management, security, safety, infection control, and patient-centeredness. Thanks.